Welcome to Talking Hope, breakthrough conversations about preventing, treating, and curing cancer. Brought to you by City of Hope, an NCI-designated comprehensive cancer center. Hope lives here in Orange County.
Hello, I'm Darren Godden, Chief of Staff for City of Hope, Orange County, and this is Talking Hope. My guest today is Frank Munoz, who serves as both chaplain and clinical researcher at the City of Hope, Orange County Lennar Foundation Cancer Center. I think it's going to be a really interesting discussion. Welcome to the podcast, Frank.
Good morning. Good morning, everyone.
Good morning. So chaplain and clinical researcher, spiritual care and mind-body medicine. Your background must be very unique to bring those two together. Can you tell us more about your background and how you were led to this role?
Yes. The foundational experience I had was during my Army chaplain training. There is a trauma ministry program where the Army uses their trauma centers to train basically their medical teams, and they included the chaplains as well. This is battlefield training. So on the battlefield, the chaplain joins the medical team to serve the dead, the dying, and the wounded. And so our role on the trauma team was to bring a sense of calm, both to the medical team and to the patient. So the training happened in San Antonio at Brooke Army Medical Center. So we were part of the medical team, and I had, the chaplains had, their position was right next to the surgeon. So we were with the surgeon, we were with the patient, or with the whole team. And out of that foundational experience, I learned how chaplains bring a sense of calm to kind of decrease the level of stress.
How do you do that?
How do you do that? Yeah, I think first, our first patient is the chaplain, is ourselves. So we learn how to maintain a sense of calm in the midst of all the chaos and the stress. And that's something definitely, it takes time, we learn how to do. And that's basically what led me eventually into mind-body medicine. So I just had lots of questions. I could see in subsequent experiences, both in pediatric and adult oncology experiences, that how we did, how I presented my spiritual care really did have a calming effect. To focus first on myself, that I remain calm and centered. And that actually had an effect, on the patient and their family as well. And so, of course, this created lots of questions for me. So I see, I can have a calming effect on patients and families, but, what's happening, biologically, physically here. And that led me to inquire about research training. So I received a couple of research training grants with the National Cancer Institute. And it led me to the mind-body medicine program, which the National Cancer Institute actually funded my doctorate in mind-body medicine. And so there I learned more about the science, about our mind-body connection. And how
was this while you were still in the military, or was this something you pursued after discharging?
Yeah, this was after discharging, I would say almost like 15 years later.
Wow.
After, lots of experiences, at the bedside with patients and families. And I think it really opened up just a new frontier. And so it was easy for me to kind of fold spiritual care into mind-body medicine. So spirituality, and religious practices, they're all about seeking peace, meaning, and that folds very neatly into mind-body medicine as well.
So tell us a little bit more about mind-body medicine. What exactly does that mean?
So mind-body medicine, what we study is how the state of our mind affects the state of our bodies, how our bodies function. And so there's definitely, physical, biological connections. Our thoughts, our feelings definitely affect how our bodies function. And the best example is stress, chronic stress definitely has an effect on how our body works. And that led me to, another level. So another question I had is, how is this affecting our genetic function, our genes? Since our genes are kind of like the managers and directors of our bodies. And so I began to learn that not only does our thoughts our feelings affect our body functioning, but also affects our gene functioning.
So what have you learned in your research?
Well, I've learned that stress creates kind of enables gene expression for inflammation. So inflammation is kind of a healing response in our bodies. And so stress is perceived by our bodies to be kind of a form of injury, and our body responds that way. So what was meant to be healing, though, begins to lead to, if it continues chronically, it begins to create other problems for us. And so techniques like meditation, prayer, yoga, exercise, those are all techniques that tap into our body's natural resources, for healing. So that's the other part of mind body medicine, is that, we do have, it does identify and articulate, our own resources, inner resources for healing, for caring for ourselves.
So interesting. So your role here at City of Hope, Orange County is both, let's call it bedside or patient side spiritual care, as well as you're continuing this research?
Yes, I'll be able, it'll be a busy time, but I think they go hand in hand. I continue to learn from our patients and families, how they cope. A lot of my learning comes from them. In fact, all of my learning has come from them. I learn from them how they're coping, how they're dealing with a cancer diagnosis. And then out of you might say, I learn how to apply what I've learned to support them.
Is this will there be clinical trials related to this, or is this a different type of research?
I think eventually down the road, I'm working with Dr. Richard Lee, and we have a couple of studies on the launch pad, one dealing with meditation and the other dealing with aromatherapy. And so those are more like feasibility studies, studies to see how well they work, with our cancer patients. And then once we get results, then we'll be able to build kind of a stronger foundation to build more clinical trials.
Very interesting. Is this a unique blend for folks who do chaplain work to also be a researcher?
Yes, I would say, I think, I really, to be honest with you, I don't know anyone else who's a chaplain, I would say, who's doing this kind of work, especially the genetics part. I actually just completed a postdoctoral fellowship in clinical cancer genomics at the City of Hope Duarte campus. First, now I'm at the City of Hope in the Orange County campus. And there I studied with Dr. Stacy Gray, cancer genomics, and her team. And so I think, as far as I know, I'm the only one who's actually delved into this territory, trying to bring, everything together. How does spirituality affect our gene expression? I think I'm the only one who might be doing that right now.
Very interesting and innovative, right? And different, a different skill set that we're bringing to Orange County, and hopefully we'll be able to expand across the broader City of Hope system as well. So let's go back to spiritual care for a moment. We talk about caring for patients as a whole person, body, mind, and spirit. As a chaplain, when you work with families or patients, what are the implications if we don't care for them as a whole person and we only treat, say, the illness?
Right. Yeah. The implications are, I would say, serious. Patients, their approach, and their families, their approach is holistic. They're using their spirituality, their religious practices. In healthcare chaplaincy, we believe everyone has a sense of spirituality that may be their own personal set, a belief system, or they may belong to a community of faith. But spirituality and religion, the common denominators, they're all seeking peace, hope, meaning, purpose. And so as chaplains, as healthcare chaplains, we're there to support that journey and that access to their resources. So for the patient and family, they're using everything. They're using a whole person approach. So for us not to acknowledge their spirituality is not acknowledging a very significant part of their lives and how they're dealing, with their cancer diagnosis.
Wonderful. And how are we inclusive of so many faith traditions or no faith traditions in some cases? How are we inclusive but still able to provide that chaplain support and that spiritual care support?
Yes, as a board certified healthcare chaplain, so we receive training beyond our religious training. So there's an extra, at least minimum, a whole another year of training where we learn how to provide appropriate support for patients, families, and also for staff as well. And so the focus is not on our belief system, but on the belief system of patients and families. So we don't necessarily have to have the same belief system, but we bring, the healthcare chaplains bring a strong emphasis, a strong sense of respect and admiration and support and compassion. We're here to walk alongside them, patients and families, and support them and help them any way we can.
So you speak about staff, and I want to go back to that in a moment because that's obviously a soft spot for me as chief of staff and caring for our team. But walk us through, when does your role get involved with the patient? How soon, when a new patient comes to City of Hope, Orange County, how soon might you get involved, and what does that look like? Is that something that a physician prescribes that you come in and talk to them, or do they have to request it? Walk us through that process.
Yeah, generally it's that's a great question. Generally, the patient or caregiver may raise a question or request that has like spiritual or religious connotations, and the provider, that might be a trigger for them to reach out to the chaplain team. I think ideally, we would be part of the initial kind of visit and assessment. If you're asking me, my opinion, we would definitely be triggered right alongside everyone else, just to check in with the patient and family and introduce ourselves. And that way, they can see us, face to face, and let them decide, if they want to make us part of their care. Obviously, there's still a lot of education and misunderstanding what the roles of the chaplain are. So we're not here to kind of push any one perspective. And I think a lot of people need that reassurance that we're here to be of support. And that's something, we can easily do, and, we're trained to do as well.
So you're literally part of the care model that we offer here at Orange County, which is really holistic and inclusive of many different aspects, right? That are just beyond, or that are beyond just caring for the thing that's in front of us. Yeah,
exactly. And we're in the process. I've actually been here maybe a couple of months. We're in the process of setting everything up where we will be integrated with the care. So physicians and other clinicians will know how to trigger the chaplain services, spiritual care services, and we will be involved in every aspect.
That's great. So let's go back to the staff piece. You mentioned the staff. I think cancer care is a calling, and we bring in some of the brightest and most caring and loving people to really serve in this area. But it's difficult for some of our staff. There are difficult times. So what sort of support do you offer to staff, and what does that look like?
Yes, great, thank you. Actually, in my military chaplain training, we learned how to provide support for soldiers and the medical teams. And so we learned a basic format, which I call kind of a spiritual debriefing. And so if the medical team is calling on a chaplain to provide some support, if they've had a hard time, difficult time, we come in and maybe open with a very open prayer and allow the staff to debrief and kind of share about their experiences. And then, I may close with a prayer. But the prayer is usually, very inclusive and reminding us of just, the transcendence of our lives. And so usually if the staff wants a chaplain involved, there's kind of a desire to kind of touch into that sense of transcendence.
Very cool. Well, it's great to have you on the team, and I look forward to seeing the great things that you do, definitely. So you're collaborating on research in the realm of integrative medicine. What other studies are you helping?
Well, I think what we hope to do in the future is I've done a couple of studies where I used the mind-body intervention to measure the effects on gene expression, usually genes involved with inflammatory response, tumor suppression, or cognitive functioning. So I hope to return to that in the near future, and also, begin studies along those lines. And I know usually, in my experience, the patients are really, jazzed and interested. They want to get involved. They want to learn more about what's happening within their bodies. And even in my postdoc experiences, patients were always kind of really keen and interested in learning more about genes and genomic education. And so that's something I also hope to provide as well. I've had some training as well, so I can speak on their level, because I am at their level. And so it's easy to lay down a basic foundation.
Excellent. You share very plainly, so it's I know some researchers can speak so high level that people can't quite understand what they're talking about, but I get the connection you're making. So are there misconceptions about the role of chaplains in healthcare, and how can chaplains work to make spiritual care more accessible to patients?
Yes, definitely. I think on the chaplain side of things, we need to do better of what kind of skill set we bring to healthcare. That's something on the chaplain side of things as a discipline, we're working on. And just to, I think I mentioned earlier, bring reassurance to patients and families that our role is supportive. We're not here to teach them what to believe or how to practice, but we're actually more the students. They're the teachers. We learn from them. And for a lot of people, it's there, but they've never really articulated it. So, we have that training, that skill set to help people become more aware of what their spirituality means and what that looks like. And for that, teach them to learn how to access. So if any teaching that we do is just helping them to redirect inwardly where their strength and the resources are, because they're there and they're using them already in many ways.
What about outcomes? What have you seen with outcomes? Just when a chaplain is involved with a patient's journey with cancer, a patient's family with cancer, what have you seen the outcome kind of be when the chaplains are involved?
My experiences, it's just some things, that patients have shared with me as things like, I don't know how I could have gone through this, without you. And again, it's like, some patients have shared, it's not so much what you say, it's just who you are. And one person was telling me, I pay a psychotherapist $250 an hour. And then, but when I'm with you, it's like, it's just a totally different feeling. And so maybe you should be a psychotherapist. And I think it was more about that presence, of that we bring with the patients and family. So, we're not the answer people, we don't bring answers, but we do bring a presence and a support to help them find their own answers and their own meaning and purpose.
That's great. I teach our OC orientation class, and one of the things I like to share is a personal experience I had when I was in the hospital a few years ago, in that I really felt like I experienced the presence of God whenever the caregivers were in the room. Didn't know what their faith tradition was or if it aligned with mine, but something about the fact that they were there and present and offering me the care that I needed at that time. Of course, it was during COVID and I was all alone, but it was very clear to me that there was a presence there with them, whether they knew it or not. And so I like to share that with our team as well, that the work we're doing, especially with our patients with cancer, is it's, in a way, it's very sacred work. And so being open to that, even if you're the MA rooming a patient or walking somebody from the front door to the elevator, that little bit of time, that little bit of presence can make all the difference in the world for somebody who's facing the challenge of their life. So
completely. I've had nurses ask me, Frank, can you teach me what to say, and, when I'm working with my patients? I say, well, I think when you display compassion and care as you're treating your patient, when you touch them gently, that is powerful spirituality. Just like you're saying, they
being
feel
fully present, right, for that moment, even if it's the 30 seconds of showing them to their next location or something. Being fully present and being aware of them and seeing them, I think, is a huge thing, right?
We feel compassion and respect that has a powerful healing effect on us.
Very much so. Touches you at the very core of who you are. You're seen as a human, and your dignity is kind of honored. Yeah, absolutely. So I think I may have said this earlier. We have the saying, when we take a patient's hand, we never let go. What does that mean to you as a chaplain?
For me, I would say it's about being able to impart, what I've learned in their journey, the support. I definitely see my role as a companion, and that what I have learned, that I'll be able to pass on to them, and I'll be able to facilitate their integration. And through my own religious academic training, I actually know how to read Hebrew and Greek. And so for me, the biblical meaning of hope is about presence. It's not so much of an expectation, it's more of a confidence in the present. And for the patient and family to know that I am, there for them. And I'm behind them 100%. And, they can depend on me to always, come through.
Thank you for sharing that. And on the heels of that, so what does hope mean to you as well?
Yeah, hope for me is not so much, not a future tense, but it's a present tense. It's a presence of companionship, that we will share each other's burdens. I will be there to carry their burdens any way I can. And they will know that, that I am there for them 100%.
It's beautiful. It's beautiful. Well, thank you so much, Frank Munoz, our chaplain at City of Hope Orange County Lennar Foundation Cancer Center. Thank you for talking hope with us today. It's been a pleasure getting to know you and the work you're doing. And thank you all for listening. I hope you'll join us next time for our next episode. And I'm Darren Godden, and this is Talking Hope.
Thank you all for listening to Talking Hope, where breakthrough conversations about preventing, treating, and curing cancer have been brought to you by City of Hope, an NCI-designated comprehensive cancer center. This is the hope you've been waiting for. For more information, visit cityofhope.org/OC, or make an appointment at any of City of Hope's 5 Orange County locations, including City of Hope Orange County Lennar Foundation Cancer Center, the most advanced cancer treatment center in Orange County. Call 888-333-4673. That's 888-333-HOPE.